Welcome, forward thinking humans, to the show that has been watching American skincare culture slowly arrive at conclusions that biology has been offering for decades, and is genuinely excited to report that the arrival is finally happening. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who has never once described skin as decoration and would like to formally welcome the rest of the country to that position. Dr. Lazuk is not with us today because she is currently embedded in a longevity research summit in Scottsdale, Arizona, having agreed to moderate a panel on metabolic beauty that somehow evolved into her delivering an unscheduled keynote, redesigning the conference agenda, and starting what attendees are describing as the most productive argument about NAD plus we have ever witnessed in a hotel ballroom. The conference organizers say she is scheduled to finish at 4. It is currently 9 in the evening. Nobody has asked her to stop. We are not surprised. We have sent water. So you have the avatar. And today we are talking about something that is genuinely happening right now in American skincare culture, a structural shift, not a trend, and why it matters more than almost anything else we have covered in this series. For most of modern history, skincare in America lived in a very specific and very limited category. It was something you did to look better. Cosmetic, optional, separate from wellness, separate from medicine, separate from how you thought about your health in any serious way. You moisturized, you exfoliated, you addressed problems when they became visible. Skin was decoration, decoration that occasionally needed maintenance. That separation is dissolving, and what is replacing it is something significantly more interesting. Skin is now being treated as data, as feedback, as a visible biological extension of your internal health rather than a surface to be corrected independently of everything happening underneath it. And once you see skin that way, once you genuinely understand that what appears on your face is a reflection of your energy production, your inflammatory load, your hormonal rhythms, your repair capacity, your metabolic efficiency, everything about how you approach it changes. This is the real story behind what people are calling the longevity era in American skincare. It is not about living forever. It is not about looking 25 at 60. It is about functioning better for longer. And skin, it turns out, is one of the most honest and earliest reporters of when that functioning begins to falter. Here is the biological reality that is finally entering mainstream conversation. Skin does not age simply because time passes. It ages because energy production slows, because inflammation becomes more chronic and less efficient at resolving, because repair mechanisms lose precision, because hormonal signals drift and cellular communication becomes noisier. When those systems degrade, skin reflects it, not symbolically, not metaphorically, but biologically and measurably. This is why two people with identical topical routines can age so completely differently. The routine is the same. The underlying metabolic reality is not. Now, there is a molecule getting a lot of attention in this conversation, NAD+, and because this is Dr. Lazuk's show and accuracy is non-negotiable here, we are going to talk about it honestly rather than breathlessly. NAD plus is real. Its role in cellular energy production, DNA repair, and oxidative stress management is genuinely well established. The fact that NAD plus levels decline with age is not controversial science. These things are true. What is less settled and significantly overstated in a lot of content right now is how directly boosting NAD plus translates into visible, durable skin change. Here is the more accurate version. Supporting cellular energy does not force cells to behave youthfully. It allows them to behave more efficiently. And efficiency, when it is improved, shows up as better recovery, faster barrier repair, shorter inflammatory cycles, more predictable responses to treatments, improved tolerance to stress. These are meaningful changes. They are also incremental. They compound over time rather than appearing dramatically in a before and after photograph. And that is exactly why they matter for the people this conversation is actually for, the people who are already paying attention to patterns rather than hunting for miracles. The same honest framing applies to at-home clinical technology, LED masks, microcurrent devices. These tools are not gimmicks. The science underlying them, photobiomodulation, neuromuscular signaling, mitochondrial support, is real. But they work the way all longevity tools work. They nudge rather than force. They reduce noise rather than create spectacle. They reward consistency and absolutely punish sporadic use in pursuit of dramatic results. A single LED mask used correctly and regularly will outperform a drawer full of devices used enthusiastically and inconsistently. Every time, without exception, because skin does not respond to accumulation, it responds to rhythm. This is also why these tools fit so naturally into the longevity framework when they are used correctly. They are not substitutes for professional care, they are extensions of it. The distinction matters enormously. Professional treatments set direction. At-home technology maintains that direction between visits. Together, they create continuity, which is the actual goal of longevity skincare, rather than episodic correction followed by passive waiting. And then there is hormone-synced skincare, which would have sounded extremely niche 5 years ago and now sounds, if you think about it for 30 seconds, completely obvious. Hormones are not static. They fluctuate daily, monthly, and across entire life stages. Oil production, inflammation, sensitivity, pigmentation, and healing capacity, all of these shift with hormonal cycles. Skin has been responding to those fluctuations this entire time, whether skincare routines acknowledge them or not. What is changing now is that people are paying enough attention to notice the patterns, skin that thrives during certain phases and struggles during others. Routines that work beautifully for 3 weeks and then suddenly feel wrong without any product having changed. Hormone-synced skincare does not mean constant product rotation or rigid phase-specific protocols. It means responsiveness, knowing when skin needs calming rather than stimulation, when barrier support matters more than exfoliation, when the most intelligent thing you can do is simplify rather than optimize. It is a systems-based approach that respects the reality that skin has seasons, not settings. What makes this moment genuinely different from previous skincare eras is that all of these ideas are converging simultaneously and being integrated rather than siloed. Metabolic awareness, home technology, hormonal literacy, longevity framing. None of them is entirely new. What is new is that people are connecting them into a coherent philosophy rather than treating them as separate trends to rotate through. And the question that philosophy produces is fundamentally different from anything that came before it. Not, what product fixes this? But, what system supports this? That is a different question. It leads to different decisions, different expectations, and different relationships with both products and professionals. It leads to skin health as something you participate in and monitor, rather than something that happens to you episodically when you spend money. Here is the grounding that Dr. Lazuk insists on adding to all of this, because longevity language can slide very quickly from meaningful insight into aesthetic theater if nobody is paying attention. Devices multiply, supplements stack, routines become identity projects, and suddenly what was supposed to reduce volatility has created a new kind of high maintenance that is just as exhausting as the old kind, just dressed in the language of science. Longevity skincare only works when it simplifies decision-making rather than complicates it. When it reduces the number of things your skin has to manage rather than adding to them. When it gives skin the energy and the space and the quiet to do what it already knows how to do, rather than giving you a new and more sophisticated way to demand things from it. Skin in America is finally being treated as infrastructure, as a system that deserves support, energy, and genuine respect rather than constant correction. That is not a cosmetic shift, that is a cultural one. And it is, for the first time, pointing in exactly the right biological direction. The tools are not what make this era different. The intention behind them is. And intention, when it is genuinely aligned with how biology actually works, tends to produce results that last. Before we close, everything you just heard is purely for entertainment and educational purposes only and does not constitute medical advice, guidance on specific supplements or devices, or a clinical recommendation of any kind. Metabolic health, hormonal skincare, and longevity approaches are complex and individual topics that deserve real professional attention. Please consult a licensed dermatologist or qualified healthcare provider for guidance specific to your situation. Dr. Lazuk will be available for consultations as soon as the hotel ballroom conversation reaches a conclusion that satisfies her, which, based on current trajectory, may be sometime around breakfast. May your skin always glow as brightly as your smile.